Thank you for joining us today for Oxygen 101. And today we have two excellent guest presenters. Our first person is Natalie Collins. She's an RRT. Hello, Natalie.
Hi.
Natalie was born and raised in the small town of Chapleau, Ontario. In her 22 years of working in respiratory therapy, she has held various positions from critical care in hospital, managing the neurodiagnostic program at Timmins and District Hospital, spearheading the new VitalAire branch in Thunder Bay, and her current role with Air Liquide as the Clinical Expert Educator for Ontario. Natalie also holds the distinction of being a recognized technical community leader for Air Liquide. So thank you very much, Natalie. And then today we also have Kelsey Kress. She's an RRT as well. And in case you don't know, that's a registered respiratory therapist. So those are the individuals that know how to figure out how much oxygen you need. I learned that. She is working as a clinical expert educator for Air Liquide in Alberta and Saskatchewan. And she has over a decade of experience treating patients with a range of respiratory diagnoses, including pulmonary fibrosis, and helping to improve quality of life with oxygen and pulmonary rehabilitation. Kelsey has an exceptional amount of care and compassion for all patients and takes in interest in educating the patients in all aspects of the diagnosis and treatment. So ladies, thank you so much today for coming on and joining us. And as you present, there'll be many questions coming through the Q&A, and I'll be stopping you to ask you those questions.
Absolutely. All right, so I'm going to share my screen and we will get the show on the road. I just want to make sure it pops up.
Yep, we can see it.
Beautiful. That's great.
Awesome. So I'm going to begin here. Today, we're going to be talking about oxygen and how it specifically applies to pulmonary fibrosis. So the things we're going to be covering today is, what is oxygen? Who needs oxygen? Is it just for one condition, more conditions? How do you get oxygen? So there is different ways of how we get funded per province and different ways we could test for that. What is hypoxia? It's a funny word, but we will teach you about that. How does oxygen help me? So how is it going to improve your standard of life, your quality of life? How it's going to help you on a day-to-day basis? The different types of oxygen equipment that we're going to cover, whether it be in your home, out of your home, at doctor's offices. Myths about oxygen. So there's a lot of false things that get word of mouth put around for things that could scare you about oxygen, but we're going to be talking about those. Traveling with oxygen. It's the different ways that you're able to stay doing what you love, get out of the house, go on vacations with that oxygen. We're going to be talking about oxygen safety, the things you should and should not do while you're on oxygen, and some tips and tricks to get you through breathing easier and improve your quality of life. So the first thing we're going to be talking about, what is oxygen? What is this thing that is going to help our shortness of breath? It's actually, you can't taste it, you cannot smell it, it does not have any color. So if it's on and you're sitting beside someone who's on the oxygen, you're not going to know, you're not going to smell anything. It does make up 20%, makes up approximately 20% of the atmosphere. The oxygen that is put in these tanks, however, is at a much higher concentration. So this is what's going to increase your blood oxygen levels. Oxygen supports combustion, but it is not flammable by itself. There's no risk of it just coming up into flames. Natalie will talk about safety with the oxygen and things that you should avoid while you're on it, however. So because oxygen affects you in different ways, it is a prescription drug, and this is something that needs to be prescribed by your physician. You can't just be sharing it with someone else who's short of breath. If you need it, you need to be assessed for it. Go next slide, Natalie. So who requires oxygen? So there's different reasons of why someone would need oxygen. The main complaint that people do have of why they need the oxygen is shortness of breath. So there's something called COPD, chronic obstructive pulmonary disease. This could include chronic bronchitis or emphysema. So this is a obstructive disease where you have a trouble exhaling all of your air. And then there's pulmonary fibrosis, bronchiectasis, and cystic fibrosis. These are restrictive diseases. So this is where you guys are having trouble taking that big breath in, fully expanding your lungs there to get that oxygen in. And then there's reversible conditions, CHF, chronic or congestive heart failure, and pneumonia. So those could be treated and helped with oxygen as well as some other medications as well. And then of course, terminal illness. But all of these conditions here would have the main complaint of shortness of breath. So there's two different ways that you are actually able to determine two main ways of determining if someone needs oxygen. So the first one is taking blood from your arteries. So it could be doctor or an RT, could be done in clinic, in the home, in the hospital, depending on where your assessment takes place. And they're actually going to be taking blood from your artery in your wrist. And they're going to be taking a small little syringe, putting it in an analyzer. And from here, you get the most accurate way to measure the oxygen that's in your blood. The second way, it's not as accurate, but this can be done at home, on exertion, in the hospital. It's a portable little unit. It's called an oximeter. And so what it is, it's a little clamp that goes on your finger. It puts a bright light source through your finger. And then after analyzing that light source there, they're able to give or have an estimation, of the oxygen that's in your red blood cells there. So that one's painless. It's very easy to do. But that is just an estimation, and depending on the SATs, depending on how high or low your oxygen is when this is taken, it's only going to be accurate to a certain extent.
Someone in the Q&A wanted to know, for the other one where they take the blood from your wrist, they said that's really, really painful, and they were thinking, why couldn't they just over a week's time take your spirometry, do that test, and get a decent average? Because they keep doing it to this person. They said it's very painful, and they don't think it's necessary to always be that accurate. So, can they push back on their respirologist to say, look, is that really necessary?
So like I was saying before, so say someone with pulmonary fibrosis had oxygen saturations in the 80s. This is only so accurate being measured by the pulse oximeter. Your doctor wants to have a very accurate number that is only able to be assessed with the blood oxygen, the ABG taken. And there's other things that could change your numbers with the pulse ox. It could be if you've had cigarettes before, your numbers could be different in the morning and at night. So the ABG is the most accurate way that the respirologists and the physicians are going to be wanting to evaluate how much oxygen is required. And it also, that number is also needed for funding purposes in the different provinces as well. So depending on what province you live in, you could either be accepted or declined for that funding from the province or the different funding programs.
Thank you.
Yeah, no problem. So how do we get oxygen? And each province is different, so please keep that in mind. I'm in Alberta, Natalie's in Ontario, and each province differs. But regardless, patients are assessed, whether that is from your respirologist, your physician, an RT, an RN, and these assessments could include ABGs, PFTs, walk tests, oximetries. There's many different ways that this assessment is going to take place to see if you do need oxygen. So once that assessment is done and it's determined that you qualify for that oxygen, the patient's going to receive a complete prescription. So this is going to include your diagnosis, as well as if the physician is wanting you to be on a specific flow rate for that oxygen, or if they're wanting your saturations to be above or below a certain number. So in that case, the RT would adjust the flow rates to meet that prescription. So after the prescription, the patient has the opportunity to choose what home care provider they want. And depending where you live, you could have 5 different providers to choose from. You might come from a smaller town where you only have one, but regardless, the choice is always up to the patients or families to choose a company that they feel comfortable with. So once that provider is chosen, there's different funding applications that need to be completed. So this is mostly government documentation that's required, whether it be even documentation for the doctors, that type of thing. So if the patient already wasn't assessed fully in the hospital, your therapist from your home care provider is going to finish the assessment and finish the paperwork for that. Once that assessment is done, this is where they're going to determine what type of funding that you qualify for, whether it's provincial funding, NIHB, Veterans Affairs has funding depending on their qualifications. And then there's different funding again for long-term care facilities. And then of course, it's always an option if you do not qualify with the other sources of funding to pay privately or have insurance. Those are always options to look into as well. So once that is decided, the patient is started on home oxygen. The therapist will come to your home, set you up on the oxygen that's appropriate, give you the portable oxygen that's appropriate, and all of the assessments and the paperwork and the decisions that are made between the home care provider and the patient are always sent back to the physician. So there's always communication going back and forth. And then these communications are sent on a regular basis when the reassessments occur.
I ask you, someone wanted to know who can help them fill out these things? Is it the oxygen provider? Because a lot of people said that they don't know where would they go and do something.
Yeah. So the patients would never fill out this by themselves. They are always going to be with the therapist, and we're going to be filling it out together. That is not something they have to worry about on their own, because they would still need to have the assessment and the testing done. And after that part is done, all of that will be reviewed in person with the patients.
All right. So we're going to talk about that hypoxia thing Kelsey had mentioned earlier. So what hypoxia is, it's a state where oxygen isn't readily available in sufficient amounts at the tissue level. So what's happening is there isn't the appropriate exchange inside the lungs at these are the little sacs in your lung, and this is the oxygen coming out and the CO2 going back for that exhalation. So what's happening is this might not be as efficient as it used to be for many, many different reasons. Depending on the disease process, it can be because there's phlegm in the airway, some swelling in the tissue. It can be that the tissue is thinned out and stretched because of the disease process. So things just aren't working the same way. So we want to be able to have that adequate homeostasis. So what is hypoxia? What does it really mean? So there's going to be lower oxygen levels in the blood, which can obviously cause damage to organs and cells if they're not getting enough of that oxygen. It can lead to serious and sometimes life-threatening complications. And oxygen is a great thing because it can increase those levels and help maintain the bodily functions that were maybe a little less adequate when we had the lower levels. Now, the only way to obtain oxygen is through the lungs. And when oxygen levels drop in the blood, most people become breathless, and that begins to limit daily activities, which becomes a vicious circle because it becomes then more difficult to do exercise. And then There is oftentimes you don't feel like doing more exercise, so you don't, and then you get a little bit more out of shape, and then it's more difficult to do exercise. So it's good to maintain that. We will talk about that further as well. So what are signs and symptoms of hypoxia? Shortness of breath at rest and on exertion. And it'll often be noticed as the first time you'll notice it is maybe when you're walking up some stairs, or if you are walking up an incline. That's when you'll start to notice it. And then it may become worse. You're walking to the kitchen or you're walking to the parking lot. And then sometimes even when you're at rest, especially in the humid temperatures that a lot of the country has had in the last couple of weeks, and even over the weekend, what happens with the humidity is the water in the air, the excess water in the air actually takes up space in the lungs. So it makes it very difficult to breathe because it's wasting that space, and then there's not the proper oxygen exchange. So humidity is not a great thing for those with difficulties breathing. So you can wake with difficulties breathing. You can have a bluish discoloration. It can be in your nail beds or your lips. You could be dizzy. You could be just general fatigued, or you can have anxiety, because the tagline for the Lung Association used to be, if you can't breathe, nothing else matters. And it's true. When you can't breathe and you are short of breath, most patients become very, very anxious. So if you do not treat your hypoxia, what is going to happen long term? Well, you're going to end up with high blood pressure. That's a first. Heart failure, heart attacks and strokes, and nobody wants that. Uncontrolled heart rates. So your heart may beat faster or it may beat irregularly. Depression and other mood disorders, right? If it's difficult to exercise and you used to exercise a lot before and you can't get out and do the things you love, it can be very depressing. Diminished exercise tolerance, so that inability to get the exercise because you are short of breath. That reduced quality of life, which comes with all of those, and severe shortness of breath, which can lead to respiratory failure. The good thing is oxygen helps. And how does it help? That's our question. So it's going to improve that breathlessness during exercise, and it's going to allow you to do exercise the way you weren't able to do it. And I'm not saying you're running a marathon, but you're going to do your own groceries, get out, spend time with your kids, your grandkids. Those are all really important things. We want your quality of life to be there. It's going to improve your exercise tolerance and capacity. You're going to decrease that dynamic hyperinflation. So what happens with some of these disease processes is it spreads out the little tissue at the bottom in those little sacs, and it stretches it, and the air can't escape. So it makes oxygen exchange more difficult. So with oxygen, that will get better. Pulmonary vascular resistance, it will improve as well. It increases the ability to deliver oxygen to your organs, and it reduces the pulmonary artery pressure. So these are all good things that we want to happen. It's going to make it easier for you to breathe, to get that exercise, and to move around. And a lot of patients will say, well, I don't want to carry this. I don't want to do this, but I want to do all the things that I loved to do. And I use my one guy as an example. He wanted to go fly. Natalie, I want to go fishing. I'm like, go, take a tank, go fishing. Why aren't you fishing? And he said, no, I want to go fly fishing. So I'm a okay seamstress. His wife was an amazing seamstress. And we, managed to get a portable concentrator in his hip waders, and off he went fishing. So much so that when we went to do a next delivery of equipment for him, he wasn't home, he was out fishing. And his wife said, thank you, but no thank you. Not impressed with you right now because he's never home because he's always out fishing. So he had a wonderful summer, and we don't want oxygen to limit you, right? We want it to improve your quality of life. All right, so we're gonna go back to Kelsey.
So now we're going to be talking about the different types of oxygen and equipment that's available to you. So depending on your assessment, it's going to change what equipment is correct for you. That's going to work with your diagnosis and your oxygen needs. So it's going to, depend on your clinical requirements. Safety concerns. Are you in a wheelchair? Do you use a walker? Do you have lots of stairs in your house? Do you have a gas fireplace? Those type of things we're going to take a look at. Your lifestyle. So are you out and about very often? Do you like to travel? Do you like to go on airplanes? Do you like to go play golf? Those type of things we will consider when choosing what type of oxygen equipment is best for you. And then of course, what type of limitations that are going to stop us with some types as well. So the first one is the most very common one. So this right here is called an oxygen concentrator. They come in lots of different sizes, colors, brands, but they all plug right into your wall. So you're able to take this piece home, plug it in at any point in your house, usually a central location. So you're able to get where you need to go. So these concentrators run for 24 hours a day. You use them like during the day, at nighttime while you're sleeping, on exertion. These also can plug into a CPAP machine, BiPAP machine, if anyone's on those and it's required. And then what we do is we hook a long tubing to it right on the front there, and you're able to get upstairs to your bedroom, down to the couch, into the kitchen. So this should not limit where you're able to go in the house. This runs all day long. It won't run out. Of course, there's cons to it as well, power outages and stuff. That is something to talk to your therapist about, and we do have backup plans for that. So it requires minimal maintenance. They're great, easy machines to use that are not a burden in your home. So this right here is called a home fill equipment, or a home fill system, sorry. So the bottom portion right there is a concentrator. It just looks a little different than that first slide, but it also has that top portion up there. So what that little extension to the concentrator is the home fill section. So what that does is you actually pop a special oxygen cylinder on the top there called a home fill cylinder, and it's going to fill up that tank with oxygen, and you can do it yourself. You can do it in your own home. So this eliminates the need for deliveries and waiting on other people for that. You're able to use that cylinder when you're out cutting the grass, at doctor's appointments, anytime you leave the house, and you would have multiple tanks, and they come in different sizes. So whether you're using it in a backpack version, you can have them in carts, but you would have multiple of them so you can fill them when you need them, allowing you to have the concentrator in your home and allowing you that portable availability to go out of the house as well.
How long does one generally last, one of those containers?
So it depends. So there's different sizes of cylinders, and then depending on the flow rate that the patient is on. So it could be anywhere, if you're on a super high flow, maybe it's an hour. If you're on a low flow and you have a big tank, maybe it's 10 hours. And it also depends on how quickly you breathe as well. And the type of regulator that you have on top of it. So there's a lot of different factors that go into how long the tank would last for. It really is patient dependent.
Thank you.
So these ones are wonderful. These are called a portable oxygen concentrator, also called a POC for short. So all the patients want these. They're nice and easy. They're battery operated, so you do have to charge them, but this allows you availability to go outside, go do whatever you want to do. This is what Natalie was saying was attached to the patient with the hip waders. It's run off of a battery, and the tubing, you just have a small tubing up to your nose. These also change battery time, so it's kind of hard to determine how long they last for, usually a couple hours depending on patients. The limiting factor with this is they do have pulse options as well as straight flow options for the different modes, but you do need to be assessed. The patients would need to be determined by their respiratory therapist that their needs are going to be covered by this machine, because there is only a limit as to how high the oxygen flow can go. So when the patients are in the office or at home and they are getting tested with this type of machine, they would put that little probe on their finger there, and we would make sure that this is an acceptable option for them. But they are lightweight. You can have them with straps. Sometimes they have wheels that you're able to pull around. They have car chargers, wall chargers, so you're able to use them on trips and charge them as you go as well. The next one is an oxygen cylinder. So you can have regular cylinders or the home fill cylinders. These regular cylinders would be delivered to you most likely through your oxygen providers. Sometimes patients come and pick them up from the offices as well. So on top of these cylinders, they come in a bunch of different sizes, sizes that would fit into a wheelchair. Let's say they could fit into the front of a basket on a walker. They can fit into a backpack. There's different modes of carrying these oxygen cylinders. And on top of the cylinders, something called either an OCD, an oxygen conserving device, and that's going to give out little doses of oxygen, little pulses of oxygen to conserve what's in the bottle. And there's also a straight flow regulator that can be put on there as well. So this is good for patients on needing higher oxygen demands. To meet their demands, it can go up to 15 liters per minute. So all of these clinical requirements are going to be assessed by your therapist. They're going to adjust the flow rate depending on the oxygen prescription given by the doctor. And this is a great option for portability as well. The last one is liquid oxygen. So there won't be hopefully too many people that have still this is an option. It is getting phased out in lots of parts of Canada, but it's another option for portability. So it's actually in liquid form, and then it turns to gas once it gets to the patient. The downside of this is it's very cold. It's about minus 183 degrees Celsius. So if used improperly, there is a risk of burn at the connection site for the people, and there is a risk of safety compared to the other devices. The cool thing about this is actually, you can see in the bottom corner there, it is actually a pale blue in color compared to regular oxygen tanks, which is colorless. But it is getting phased out in lots of portions of Canada. I believe Ontario is possibly the last ones that still have it with our company anyways. So
Kelsey, can I ask you, someone said, what happens if you need liquid oxygen because of your flow rate and everything else? Like, how will the other equipment, supplement if there's no liquid oxygen?
So there's different options. So with the concentrators, that's the home concentrator that's plugged into the wall, there's different flow rates that can be put on there. There's 5 liters machines, there's 10-liter machines. And then if it ever was a time that you required more than 10 liters machines, the therapist will put 2 concentrators together and we deal with it then. So there is options for that. And if a patient required higher oxygen on exertion, we would be putting them just on a regular oxygen tank with a straight flow regulator at a higher flow. And they would just have more regular deliveries, or they would set up on a home fill system too, so they can be filling up their own tanks as needed. So there's always options that your therapist will work with you with good communication to work out to keep these patients doing what they love and increase their standard of life for sure.
Kelsey, in the Q&A, someone wanted to know, like, why is your company no longer providing liquid oxygen?
It's just being phased out. There's better options available, more safe options available. And that was just a choice made by our company. Natalie, you work with it more. Do you have a better answer than what I just gave?
And that's exactly it. The safety thing was a big issue. Bringing it to places, especially in the northern regions, right? fill up a liquid tank in Toronto and you ship it to Thunder Bay, and oftentimes when it gets here, it's empty. So there's lots of little moving pieces in terms of the liquid oxygen. I think Ontario, you are right, Kelsey, we were the last kind of area to have it, and we are phasing it out. And I know some companies are, some companies have, some companies will, but it's actually in the long-term care homes had a great reception because we've been moving more towards the POCs. Patients find it's easier. It's a lighter unit than the portable liquid, so they are able to better move around with it. It's plugging in, and especially in the long-term care homes, it's the safety, right? Or even not in the long-term care homes. If there's kids, grandkids around, and that liquid's there, that can be a problem. And it has been a problem in the past. So lots of different reasons it evaporates. So you might get a delivery and your tank is empty, right? So that just prevents a lot of that.
And just keep in mind, different companies will have different decisions. So depending on the home care provider, they might have different POCs, different concentrators. So everyone's a bit different across the country.
Because someone was saying that, is there a POC that gives more than 6 liters other than liquid O2, right? Because the liquid oxygen, you can do at a higher rate flow, because unfortunately for most pulmonary fibrosis patients, they usually are the higher end, like a 10 or 12. And so quite a few of them, are very concerned, like how will they get the flow better, like because the general oxygen concentrator give them that flow rate.
So they would be put on a tank for portability, on a straight flow regulator.
There are a couple of POCs that do go higher. They are a little bit bigger, a little bulkier, but there are some that do go higher and a continuous flow.
Because a lot of people feel that this really cuts their freedom in half because they need the higher rate flow, and they feel very strongly that liquid oxygen is the one that can really provide them at the higher rate flow rather than the concentrators, because then they're sort of tied to something.
So they would be on the concentrator at home, but they would be on a tank, which would provide the same support while they're being portable. So there really would be no changes to patient care. They're still receiving the same amount of oxygen.
No, because a couple of people are saying that they have to figure out how much oxygen they have to take with them if they're traveling, and with this, you got to bring tank after tank after tank because it's just really hard. And someone wanted to know, can you install something in a car so that then you go to their car or your trailer and refill your tank?
That would be a home fill unit that most companies have now. They might be different brands, but that would be a home fill unit that lots of patients have, that you're able to fill those different sizes of tanks. And on travel, Natalie's going to cover it, but we would always make sure that the patients, to our best ability, is able to travel as freely as they can with the necessary supplies.
Someone just mentioned that a liquid stroller lasts 2 hours at a 8 liter per minute flow. So, it's kind of hard.
Yeah, and they might be with a different company, so all of it's so different for what's available. But
yeah.
And I do have, like, I moved to Thunder Bay to open the branch here, and I have multiple patients who are pulmonary fibrosis and who do very well without liquid. And we have no issues, and we work around whatever we need. And I do have some patients who don't like the liquid. They find it too cold, and other reasons we've switched. So there's always different camps, right? There's the camp of this, there's the camp of this, and everyone has their preferences. So that's part of it.
Okay, thank you.
All right. So let's move on to some common myths about oxygen therapy. So oxygen is addictive. That is a myth. The more People say the more you use oxygen, the more you become dependent on it, but this is not true. When lungs are unable to deliver the oxygen to the body, those organs are going to starve of oxygen, or be starved of oxygen. So supplemental oxygen increases the concentration of oxygen in the blood, and it satisfies the body's demands for it as we use it. Oxygen is flammable, and Kelsey touched on this before. Oxygen supports combustion, so oxygen won't start a fire, but it will make a fire a little bit bigger. So we need to be very careful and cautious with that. So oxygen concentrators, portable tanks, and those liquid bases will not spontaneously explode. Oxygen limits your activities. That's false. We just talked about it, right? Living with oxygen improves that quality of life. It helps you get more exercise. It helps you be less short of breath. And you can travel anywhere in the world. I have a patient who leaves Thunder Bay every winter and goes to the south of Italy. Comes back for the summers in Thunder Bay and goes back. It doesn't limit them at all, and it shouldn't limit you. Oxygen equipment is heavy, bulky, and impossible to travel with. It is bulkier. And sometimes it can be bulky, but it is much better than it used to be. So I've been doing this for a few years now. And it used to be bigger and bulkier. And as time comes and technology advances, things are smaller and smaller and smaller. And I think with a little bit more time and the progression that portable concentrators have made, even in the last 5 to 10 years. 10 years ago, they were big honking suitcase size things that you had to drag behind you. And now they're like little purse size things that you carry in a little bag on your side or on your back. So that as the technology advances, I think they will get smaller and smaller and smaller. So you can store oxygen in your body, and therefore you can use it less frequently. So this is false. Once removing that supplemental oxygen, those levels will fall off quickly in your bloodstream. So we need to make sure that if we have been prescribed to wear oxygen, that we wear it as prescribed and not just whenever you feel like you want to use it. So we talked about this, traveling with oxygen. So just because you have oxygen, it doesn't mean you're stuck at home. There's equipment available that allows you to be mobile, and the ability to bring that oxygen with you anywhere you go can be worked out with your home care company. Home care companies are more than happy to make plans. If you're traveling to somewhere, I have patients who often fly to Toronto for appointments. I can make arrangements with the Toronto area to deliver equipment to hotels or family members if you're traveling for pleasure. It happens and it can be done. It's never an issue. We want you to enjoy life and travel with confidence. So airlines, bus lines, and trains all approve travel with oxygen. And there just needs to be a little bit of prep work. That's all. So if you are using oxygen and you are traveling, it's very important to, if you have a travel agent, contact your travel agent. Sometimes with air carriers or train companies, you have to get a paper signed by your family doctor, and you need to make sure that you have enough oxygen or enough battery power in your portable concentrator to last the duration of your flight. Some airlines will require that you have enough battery power or oxygen for 2 times the flight. Some airline companies will actually only allow you to use their oxygen. So it's really important to connect with the airline or the train company that you are traveling with to make sure that you have everything and all your ducks in a row before you show up at the airport and you are refused to get on the plane. We don't want that. So make sure you contact your family doctor or your nurse practitioner. They can print the forms, you can print the forms and get them all signed off and ready to go. And then Sometimes airlines will need at least 2 weeks notice for that. So very important as soon as you're booking your flights to get all that information in so that you don't have to worry about. And then your oxygen provider is obviously an important call as well, because they're going to make sure you have enough battery or enough oxygen to get you to where you're going, and then to make sure that you have oxygen once you get where you're going. And obviously you need to enjoy your trip. That's important too.
Sorry, Alex, someone wanted to say that their portable tank is not really freedom because it only lasts about an hour for them. And that means they have to drag it behind them. They have no free hand to hold on to their kids when they're traveling.
So
So
they're portable, like their POC, their portable tank.
tank, yeah. They have it in a cart and they tow that behind them. And so when they're carrying groceries and everything, they don't have a free hand to hold on to their kids. And then that portable tank of theirs only lasts for an hour. So they just say that it's not really freedom on high flow.
And it can be a little more difficult with the high flow. And anytime you can, I'm assuming they have difficulty with the shoulder strap, but you can get the backpack, which I find patients who sometimes, instead of towing with the backpack, it's a little simpler and a little more easy because you're not just putting it on one shoulder and having all that weight on one shoulder. The backpack does, I find, help. And I have a lot of patients who prefer the backpack to the one shoulder style. So that can help with the hands-free and stuff like that. The other thing is, if you were at the grocery store, to put it in the cart, that kind of frees up from that pulling thing. But it can be a little more difficult. Yeah, you're right.
Thank you. The other thing I wanted to tell everybody here on this webinar today is that if you go to cpff.ca, we actually have a section for travel, and everything Natalie just said, it's there. We have a list for you, and we actually have links to the airlines and to the various people that you need to contact to say this is what you're doing. Because as Natalie said, you need to give the airline at least 2 weeks of notice that you're doing this and that they have everything arranged for you, right? So they pick you up with a wheelchair so that you're not exerting yourself, and they get you on the plane, and they have your oxygen cylinder tanks there waiting, because the chargers on there don't work on the plane chargers, like the plugs. It doesn't work that way. So
yeah,
Sharon,
and sorry, Sharon. We'll often send our patients with extra battery. Like if I know they need 4 batteries to get through, they go with 4 batteries.
Oh, and someone just wanted to let you know, Natalie, that backpacks don't work for e-tanks, just to let you know.
You can get a backpack for an e-tank.
Okay. All right. Then you'll have to tell us that information, and we'll have to post it afterwards to let people know.
Contact your vendor. You can get a backpack for an e-tank.
All right, folks, you heard that from Natalie. So contact your oxygen provider for a backpack for your e-tank.
I actually just gave one to a patient last week.
Okay. And I don't know if you're going to address this later on, but several people have said, Natalie, we have the universal remote to turn on and off your TV, your channels and everything. Like, why can't we have one of those for our oxygen tank? Because when I'm sitting, I don't need that high rate of flow. But if I have to get up to get a snack or walk or do something, I need the higher rate. So, it's a real pain to get up and turn it off and hurry up and get to the chair and, hurry up to get up and quickly turn it on so I can get moving.
So I have 4 teenagers, and my favorite line is, patience, grasshopper, patience. It's coming. So there actually has been talk, because that is a huge, huge issue. I agree. Like, wouldn't that be so convenient? These are coming. These are things that are coming. And when you think about the advent of all of this oxygen equipment, POCs have really only been out the last, 10-ish years, Kelsey? And when they first came out, they were huge, suitcase-sized things. Now they're smaller, and they are always making improvements. And there are smaller, remoted ones that are, creeping up from the States. We just need approval in Canada. So I think before we know it, we will actually have that technology. It's just going to take a little bit of time to develop that. Right now, I think they're still in the process of smaller, right? Smaller, less heavy. I think that's kind of their focus, but I have heard wind that some companies are kind of working on that remote for the concentrators, the bigger concentrators that you plug into the wall. Because when you get home, you sit on the couch and you're like, oh, I need to get up to do something, right? So it's coming. It's just we need to be a little more patient. They're working on, I think a lot of new things are going to be coming out in the next little while.
Natalie, I just want to let you know that the Canadian Pulmonary Fibrosis Foundation is always interested in collaborating with the oxygen providers as partners to see how can we advocate for these devices to come to Canada so that our patients can access them, because enjoying your life and all that, part of it is having the oxygen that you need, right?
Absolutely. So there is an organization called ORSA. It is the home care organizations that all get together and lobby the Ministry of Health across the country to be able to have more accessible, easier accessible, all of home care kind of things. And I know that that is a battle that we fight all the time, and we will continue to fight. But it's just reaching out and absolutely begging and kind of not begging, but you know what I mean? Trying to get things pushed. We all know that this government can be slower moving, but it's just the push to get what we need. But it's definitely in the next little while, and I'm going to say in the next 5 years, we're going to see great leaps and bounds, because it is such a newer technology. It's like any newer technology, it kind of is stagnant and, hey, this is great, isn't this fabulous? And then all of a sudden it just kind of takes off. I think we're at the point where we're almost ready to take off. So I think we're going to see smaller and more technologically advanced, especially with AI and that kind of stuff coming up and being more prominent. We will see a lot more of that in the coming years.
Thank you.
Sharon, I just wanted to intercept there, just regarding that patient that was stating that her portability is not amazing while she's out with her kids and stuff. It's also so important for patients to make sure they're communicating these discussions with their provider too, because maybe their providers have better options for them, different options than when they were first set up. Maybe their needs have changed and they need a different type of equipment. So the communication needs to be there with their provider as well to help eliminate these frustrations.
Thank you, Kelsey, because we at Canadian Pulmonary Fibrosis Foundation, we advocate with all our patients to, speak to their providers and engage them in the conversation about what they're looking for. Because quite often, as you said, maybe you can come up with something that's unique for them and help and support them where possible. So thank you.
All right, let's talk about safely using oxygen. So obviously, we've talked about oxygen being flammable, not combustible. So we need no smoking or open flame or sparks within 10 feet of oxygen equipment or tubing. And then be 5 feet away from any appliance that sparks. So that's your gas fireplace, your gas stove, etc. Now, if you are using an electric stove, what I do always tell my patients is to take their cannula, tuck it under their shirt, bring it up, and then put their cannula on. Because when was the last time someone burnt their shirt on the stove? Doesn't happen very often, right? If at all, I've never heard of it. But that keeps the cannula close to the body and away from that combustible material. So you definitely need to have your no smoking sign posted on your outside door, and it needs to be visible for the fire department. You need to have a fire extinguisher in your home. Avoid use of petroleum-based products. So your Vaselines, etc. We need to not use those. Your Purell as well. They are flammable and combustible materials near oxygen. We only want to use a water-based lubricant. So if you are dry in the nares and want to use something, there are tons of different products you can use, Sakaris being one of them, but all you need to do is go to the pharmacy and say, I'm on oxygen, my nose is a little dry, can you recommend something? And your pharmacist will have tons of little tips and tricks as well in the back to be able to help with that nasal dryness if it happens. As well, communicating with your home care provider is a big one for that. We don't want to store our concentrator or our liquid oxygen in confined spaces such as closets or in garages either. And we don't want to set flows higher than prescribed. Too much oxygen is just as bad as not enough oxygen. And that is an important one to remember. And obviously, like I just talked about earlier, be aware of cooking and tuck that cannula underneath the shirt that you're wearing just to protect it from getting close to the stove. So tips and tricks for easier breathing, and I'm sure a lot of you guys have heard these before. Exercise at your own pace, whatever that may be, but get the exercise. It's good for you. Sometimes I have patients who just raise their arms while they're watching TV with soup cans. Easy, and that's where they start. And I have patients who walk around the block once a day, twice a day, 3 times a day. So it all just depends on what your levels are. But exercise is very important. It's just at your own pace. Diaphragmatic breathing. So belly breathing. Lay on your back, place your hands on your abdomen, and practice breathing with your belly. That's an old standby. It works really well for when we are having some shortness of breath. And pursed lip breathing also helps. So basically you take a nice big deep breath in, and when you're breathing out, instead of just breathing out normally, you would breathe out like you were breathing through a straw. So, and what that helps is to slowly exhale the breath. And a lot of times when we are short of breath and we do have that anxiety, that pursed lip breathing will also help us stop breathing too quickly, and it helps relax us a little bit as well. The tripod, sticking your elbows out onto a table to help create that tripod. Sometimes that will help. And then you can ask about inspiratory muscle trainers. So there are all different kinds, and that's something you can talk to your respirologist about. But they are definitely out there and helping as well. So last but not least, we want to support our loved ones who are on oxygen or having difficulty breathing. We want to make sure we check the pollen counts before we go outdoors, especially in the spring and the fall and during the summer too. It's been a crazy smoke season with wildfires. That's important to check as well. You want to make sure that you do carry your inhalers and accept help with outdoor chores, especially when it's been hot and humid out. Wear a mask to help filter out that smoke or the pollen. Be careful with your spring cleaning and your dust levels. Make sure you use unscented products. Install that dehumidifier if it's necessary, and pace yourself with exercise. And the most important thing is to have compassion, because sometimes it can be very, very difficult and overwhelming to try to get all the stuff done that you feel like you should be able to get done. So have compassion with your loved ones, but also have compassion with yourself. That's an important one. And we are going to open up the floor for questions.
Great. So folks, if you have questions, please put it in the Q&A and I will ask Natalie and Kelsey. The first one I wanted to ask you was, what about the forest fires, the impact of that? I know that a lot of our researchers are predicting that those tiny, tiny little embers are going to affect some people in their lungs, and that down the road, a lot of people will start needing to have oxygen. Right? Do you see the increase in need for oxygen from the last 2 years with all these forest fires?
I have seen a lot in terms of, and we really haven't had a lot in Ontario. We're just getting this, well, we did this spring, but I have definitely seen some patients on oxygen that I didn't really think, had we not had the forest fires, would have needed oxygen. But there are days where, you know, when you're at the fire pit and you're sitting there and you can't get out of the smoke no matter where you go. I was visiting a different branch and I was stepped out of my hotel and the entire city felt like that. It didn't matter where you went. You felt like you were sitting in the path of the smoke at the bonfire. So absolutely, there are going to be more patients affected by this. And then in the coming years, I think there will be an impact. Absolutely. Kelsey can speak to it. She's kind of right in there right now.
Yeah, for sure. Just what Natalie said. We might have seen some more patients being set up on oxygen that had the pre-existing conditions, and I'm sure it'll just continue on the same path, which would just prove the importance of wearing those masks, staying indoors when the smoke is really heavy, and try to limit that exertion activity when out of the house.
Patients wanted to say, you know, their home concentrator, the one that you plug into the wall, it's very, very noisy. It's like having a 747 jet engine in your house.
Yeah, so different brands of concentrators, and depending on if it's a 5 liter, a 10 liter, they do sound different. It's that compressor turning on the inside. An option for the patient would be to put it in maybe a spare bedroom and have the door closed and ask your provider for a longer tubing to get where you need to go, or put it in a portion of the house that's not straight in front of the TV or right in your kitchen and in an area that you're going to be all the time, to try and push it to an area that you can have the sound occluded a bit more.
Someone wanted to know what's the longest tubing they can request from their provider, because it doesn't seem to go long enough.
So it's never going to go long enough. So the recommendation is 50 feet. Kelsey, you agree?
Yeah.
You can't, the reason we can't go much longer than that is, especially with the higher flows, we can't guarantee that what's coming out of that tubing at the other end is what I've set at the machine. So 50 feet is usually the max.
Someone wanted to know, how do you uncoil your tubing?
Time.
Yeah.
It's pretty coiled up when you first get it, just for packaging reasons. But over time, even if you kind of pull it out, Natalie, do you have any tricks? It seems like it just kind of flattens out as you wear it.
I actually have a patient who pre-lays out her tubing before she, like if she's like, oh, my tubing's starting to go, she will actually lay it out in her spare room to stretch it out. Sometimes different brands of tubing, depending, have less coiling, but that's one of those unfortunate, there's no other way to store it in the bags, right? Other than stretching it all the way out. But yeah, I do have a patient who uncurls hers before she uses it.
And it's just a couple days where it does stay that kind of kinked along the floor, but it would just pose as a safety risk for patients who maybe have a walker or wheelchair. Any type of movement like that would just have to be careful while walking, so their feet don't get tangled in the coils.
Someone on the Q&A just shared that they said if you put your tubing in a bathtub of hot water, it will uncrinkle it. So I don't know, maybe that might work. People were asking, you know, how many tanks do you usually give to someone? Do you try to calculate it by what you think they need? And if they need more, you know, how do they go about saying, hey, I need more?
So for safety reasons, it's a max of 10 tanks per household. Yeah, 10 tanks would be the max that each patient is getting.
And I would determine how many tanks by, like, I always start my patients with 3 or 4 tanks. And during that first week, kind of see how many do they actually use? Do you use 1? Do you use up all 3 in a couple of days because you're out and about forever? And it all depends. Every patient is completely different. So it's that, here's 3 to start. Let's see where you end up. And then you assess from there. If they need more than that, do they need a POC? Are they good with tanks? Because they're using 1 a month. That's all they're using. You only need 1 tank a month. That's great. We go from there. But it's kind of an assess as you go and a continuous assessment. And then there's the drivers go out once a week or once every 2 weeks, depending on what their needs are. But it's, if I had a patient who was like, you know what, I joined the pickleball league and I want to play pickleball twice a week now, I need more tanks. They would just call me and say, hey, Nat, I need more tanks. And that would be the end of it. And I would add more to the delivery. That's it. Simple call.
I wanted to know, they don't live near a city, they live sort of remote. So how do they go about doing that? Because, you know, it's not always easy. I mean, if you live in Toronto or Thunder Bay, it's relatively easy. But if you live in the outer skirts and you need some more, it's not like they can come by, pop over, drop it off the next day. Like, what should they do in that case?
So you, oh, go ahead, Kelsey.
Go. I was just, Natalie and I are both in that same situation. We are away from the city. So depending on the patient's location, their needs, that's where the therapist would go and assess, does this patient need a home fill? What's the best suited option for this patient to maintain their portability? So if they are not close for those tank deliveries, some of the drivers do go pretty far, but if it's more reasonable for this patient to have that POC, ones that meets their needs or has a bunch of E-size cylinders on a home fill, that's what they're going to be set up with. So it doesn't matter their location, the company that they're working with will work with them to keep their quality of life there and let them do what they need to do.
And I know we in Northern Ontario, but I think it's a little bit of all of the organizations have what we call depots. So I think of the Timmins area in Northern Ontario where they service Hearst, which is about a 4 or 5 hour drive away. And they actually have a depot there where when their driver goes, we'll say once a month. I think it's more often than that, but let's just say once a month. They have a spot in town, the auto shop where you pick up parts. I have no idea, just randomly saying. And they have a rack of tanks there so that if a patient needs something and they, you know, their home fill or whatever, they just go to that depot and say, I need more, and they pick up more. So depending on the company that you deal with and the remoteness of the area that you actually live in, those are possibilities as well.
Someone on the Q&A said that they're in Fraser Health in the BC and they aren't able to get weekly deliveries yet. Is that because they're far out?
Probably. We have some cities that are like a monthly delivery, some are every 3 weeks, and it's the feasibility of how far some places are out, right? So it just depends on where you are and what you need, but your home care company should make sure that if they are only delivering to you once a month, we'll say, that you have what you need for that month.
Natalie, someone wanted to ask you for clarification earlier in the presentation. Either you or Kelsey had said that when you're traveling, you know, you would make arrangements. So does that mean the patient should contact their oxygen provider to say, hey, I'm going to Italy. How do I make sure I get oxygen over there? How do I make sure if my equipment breaks down, like who do I go and talk to and get replacement parts and things?
So within the country, super easy. I'm in Thunder Bay, Kelsey's out west. If you're going to her, I make arrangements with her. You can go to the VitalAire website and you can stop in at any of the branches and pick up whatever you need. If you're traveling out of the country, it is a little more on the patient usually, but most of the home care companies will kind of give you a little bit of guidance in terms of you know, who to reach out to and stuff like that. Some of the companies are international, so there is that as more of a backup, and some of them are not, but we definitely try to help our patients so that they have an understanding of, well, if you're going to Italy, it seems we're all going to Italy, which would be great, that they have the, you know, I'm going to Milan. Well, you know what? I'm going to do a little Google. This is a spot for you in Milan, right? So some of the home care companies will help you with that, and some of them will kind of give you a little bit of guidance, but usually to ship things out of the country, it's a little bit more difficult, but at least we would have a spot, make sure that if my patients are traveling internationally, that they have a spot that they can go to pick up stuff if they need to.
If anybody has any more questions, please enter them in the Q&A section. Otherwise, here's my last question. So someone said they were traveling to the US and they got stopped because they're carrying portable tanks of oxygen. And they said that that wasn't allowed. So there's a general confusion. So I've never heard of that. So I wonder if you heard of that.
No.
Never heard of that. I would suggest that all patients, if you're crossing the border, even on land, to have your prescription with you as well from your doctor, just to show I need this for medical reasons. Like, you can't pull this. It's a necessity.
Okay.
Yeah, I have patients who travel. So in Thunder Bay, we're like half an hour from the border, and right on the other side of the border is a fabulous casino. And I have tons of patients who travel to the casino like every weekend with tanks with no issues.
Well, I don't know, maybe because these border people understand, or sometimes
Yeah.
border people don't understand, so they think it's not allowed. I don't know.
Mm-hmm.
Yeah, and you're not wrong, right? You catch a newbie at the border who's just started working there and they're unsure, but tanks can definitely cross the border, no issues. But Kelsey's right, bring your prescription. That's a game changer.
Someone said that even though you bring your prescription, they're saying that it's not always recognized because it's not from a doctor from that country.
So if you're crossing to the States, then usually they don't, I've never heard of anyone getting a hard time. If you're traveling internationally, little bit more, that's where it tends to get a little bit more difficult, right? The recognition of a physician in a foreign country, because it's like that in Canada as well. If I had a Korean patient come with a prescription, and unfortunately, we can't recognize that because it's not a Canadian physician, but we fixed him up and it was all good. But it's just the different physician rules
Standards,
and regulations. Yeah. It is a little tougher when it's international, yes.
I don't see any more questions on the Q&A, so I want to thank you, Natalie and Kelsey, for today's presentation. And as I said before, if you go to CPFF website at cpff.ca, you'll find our travel section where Natalie had before talked about all the things that you should consider and do before you travel. And we have a great website with all that information. And I know that recently we had a patient that went to the UK, and they were very leery, but they said that by following all those tips and everything, they had a fabulous time, and they would encourage everyone to go and read it and figure out where you want to go. It takes a little bit more planning, but you'll enjoy it if you could just plan the whole thing, right? And so, and at CPFF, we also try to connect you with somebody at the other end where you're going to, because we have similar organizations, and we always say use them as a tool that understands your disease, understands your needs, and so that even if you don't speak the language, they will know how to help you out. So thank you both for coming on today, and it's been a fabulous presentation. I hope everybody enjoyed it, and come back in a couple of days, and it'll be on our YouTube website.
Thank you for inviting us.
Thank you for having us, Sharon.
Take care. Bye-bye, everyone.